Tension has surfaced again in the Nigeria's healthcare sector as Nigerian Medical Association has rejected review of allowances for medical and dental officers in the Federal Public Service by National Salaries, Incomes and Wages Commission. Speaking at a press conference held in Abuja, the president of the association, Professor Bala Audu, said the circular dated June 27, 2025, failed to reflect terms previously agreed upon during collective bargaining processes with the government. They issued a 21-day ultimatum to the federal government to address its demands or risk a disruption of healthcare services nationwide.
Some of these arrears have been pending for 18 months. Nobody has asked how and why doctors have been so patient for 21 months. Budget has, from the best of our understanding, provided the funds. However, these funds have not been released. So we believe currently the problem lies at the level of the Ministry of Finance. Then the allowances we are talking about, there is nothing new about them. These are issues that were resolved, agreed and implemented since around 2001, 2009, and the latest was even 2014, more than a decade ago. However, when calculations are being made, wrong calculations are made. And we have drawn attention to the initial wrong calculation that was made, and we made submissions to the National Wages, Incomes and Salaries Commission. So, as far as that is concerned, the problem is at the National Wages, Salaries and Incomes Commission, and they need to be called to order to address these issues. All right, the circular that they produced after we have sent the corrections to them was done unilaterally. We were not engaged in any discussion, and you can see other healthcare workers were also not engaged, and this is causing a whole ripple effect in the entire healthcare delivery system in this country. So the National Wages and Salaries, Wages and Incomes Commission needs to be called to do the correct thing on behalf of the Nigerian people.
While laying out over 9 demands to be addressed, they called on President Bola Ahmed Tinubu, the National Assembly, to address their concerns.
Our demands include, but are not limited to, an immediate withdrawal of the circular on review of allowances for medical and dental officers in the Federal Republic of Nigeria, dated 27 June 2025. Number 2, an immediate correction of consequential adjustments in line with the agreements reached in 2001, 2009, and 2014 collective bargaining agreements. An immediate correction of the relativity agreed between Commerce and Congress and compliance with relativity in professional allowances in accordance with the 2001 CBA, particularly regarding call duty allowances and the payment of accrued backlogs. An immediate settlement of all outstanding arrears, the 35% commerce, clinical duty, and accoutrement allowances owed to medical and dental practitioners. That we hereby expect that attention will be given to our demands within the next 21 days to avert any disruption in health services rendered to the Nigerian people.
The medical professionals insist that the well-being of citizens depend on the fair treatment and motivation of the medical workforce.